great thing. I have been working with, I have been attending yoga classes with Happy 60 Plus since 1 year. It has helped a lot. My mobility has come up and movement in my legs, hands, and all. They were so stiff, because after so many years, I was not doing any much work, retired person, so not doing much work. Now the chair yoga is there. So the yoga teacher teaches us so well. It has improved my health altogether. Overall health is increased, and I am very happy with that. My mobility is increased, and my thought also, it has given a refreshing, stimulating my thoughts. The yoga, that meditation, and all sorts of things when you are doing, so your mind also becomes fresh. So I am very happy with that. I am having a happy life because of this Happy 60.
I'm so glad. We're so glad to hear that, ma'am. Thank you so much for sharing. Now that I think most of the people have joined, I would like to pass on the mic to Dr. Nischal here, who's specializing in general medicine. He'll be talking about how to achieve that freedom from fall. Over to you, Dr. Nischal.
Thank you, Hema. It was a good introduction. So, in brief, before we start the session, I'll just be telling you about the organization. So, yeah, I'm Dr. Nischal. I'm a consultant physician at Bridge Health. So, Bridge Health, am I audible?
Yeah.
Yeah, okay. So, Bridge Health is a preventive healthcare organization. So, let's make the session an interactive session. So, we are into prevention, and our specialty is more into a geriatric population, and we cater RWAs in resident welfare organization. We run clinics there, more of a preventive healthcare, because all this while healthcare was more of reactive. Only when you fall sick, you used to go to the hospital or to an OPD to doctor, and he used to prescribe you some medicine and he used to send you back, advise you for some few blood tests, and then ask you for a review. Overall, healthcare should not be like that way. You should not go to a doctor only when you're sick. A doctor is someone, a teacher, so he will have to prevent certain things to the population, where all we can make some changes. So when we started this program called Freedom from Fall, I don't know if everyone is aware of our organization, Bridge Health. So I would just want to know how many of you know who are the founders of Infosys. You have an idea?
Narayan Murthy is one of them. Sudha Murthy is, I think, also one of the partners.
Okay, okay. Yes, there's another co-founder called Chris Gopal Krishnan. Have you heard of him?
Yes.
Yes. So I'm happy to say that he is our founder of the organization, and he's come into healthcare now. There was one gist of it when he was more into his tech. He saw there's a lot of need in it post COVID, when consultations were happening online and when people could not go to direct approach with doctors, and regular medical care was not going in the right way. So he thought we should start an organization something like this. So Bridge Health is bridging the gap between an actual patient and the need what a doctor has to do. So when we started this program called Freedom from Fall, after a lot of thoughts, so fall is something which might sound very simple, but it is not that when you're aged. Yeah, okay. So as Hema was telling, she was just discussing the statistics with you. You know how many percentage of people, elderly people, fall post 60. A recent study which done by 19 public health institutes in India tell above 60, 30% of the population fall at least once a year. About 80 years, 50% of the people population who are 80 years at least fall once a year. And why fall is important when your old age is, it's not just fall, it's all the other complications which are leading from fall, which will cause illnesses. So is everyone seated in a very comfortable position? Before I start my presentation, I just want them to do a small drill. Is it fine?
Yeah.
Yeah, okay. Yeah. So I would just want all of you to just close your eyes, just listen to me. Okay. If you can get up from your stool, you know, closing your eyes. Is everyone able to follow it?
Yes.
Okay, yeah. Okay. Now, can any one of you lift one leg of yours? I would not suggest this to people who are with walkers or on immobility issues. So while closing your eyes, you stood up. Can any one of you lift one of your leg?
Yes,
How many could do it right?
I can do it.
That's nice. Okay. And now can you raise one hand of yours? Closing your eyes, one leg elevated.
One leg and one hand, is it?
Yes. Yes.
Yes.
इस फुटेज के मुताबिक
Yes, it's possible.
Yes. So I think mostly in an elderly case, not everyone will be able to do it.
Yes, lifting the left leg itself is difficult.
Yes. So what was very easy then, long back, when you were young, was just a normal phenomenon. Now, once you're aged, it's hard for you to even get up, stand, and walk properly. And once if you've had a history of fall and there's a fear mongering and you're into many other things, there is osteoarthritis, people are on long-term medications, some people are on depressants, all this will affect your cognition. So in such cases, fall is an emergency condition. So standing, walking, mobility does not just depend on our physical strength or our knee support or anything. There's a lot of other things which will be discussed in further in my presentation. So that is why we told certain things which was simple then is not easy now. So that is why when we came up with this program, we wanted to name it as freedom from fall, because statistics says that 30% of the population above 60 fall at least once a year, and 50% of the people above 80 fall at least once a year. So there's a huge number of people who are getting into other medical
Laptop
problems.
Lorada.
தெரியலையே
Yeah, can I continue?
Yes, yes. I
Yeah.
think people who have not mute, please mute yourself if you're not talking. Let the doctor talk continuously. Please do not disturb.
And a request, doctor,
Yes,
please
ma'am.
make it a little bit of Hindi also in between, Hindi and English mix.
Hindi, I'll try to.
Yeah,
I'm not
yeah.
going to win. Okay, wherever मुझे थोड़ा थोड़ा तो हिंदी आता है, लेकिन
Uh-huh.
presentation करने का I'm still in my doubts. Okay,
Yeah.
I'll explain you. This is not. It's very simple terms.
Yes, yes. And I would also like to request the members if they can switch on their videos, it would be more interactive.
Yes, yes, that would be nice for me also. Yeah, Hema, have I shared the screen from presentation?
Yes, yes, yes.
Can
We can
everyone
see the
see
first slide.
Yeah.
Okay.
So who is Dr. Nishal or Hema who is sharing this screen?
Also,
Dr.
this is-
Nischal
Take
is.
it in presentation mode so we can see it better. Yeah. Yeah, that's good.
So, as I told you, falls are common in elderly, but are very preventable, and most people don't give importance to it. Here, what are we going to see is we're going to understand what are the personal risk factors, how to reduce your risk of falling, home safety tips to prevent falls, manage yourself outdoors, and what to do in case of a fall.
hello my video
Hello.
is stopped I
Yeah,
don't know
Hema?
why.
It's
is
okay,
it-
sir. It's okay. That's fine.
Okay.
Yeah, sir. Please
Okay.
continue, doctor.
So as I told you, there's a balance system in the body. For us all to stand, walk, to maintain a balance, there are three things which majorly plays. One is the visual signals, what is sent by our eyes. Our eyes sends, and another is we have a vestibulocochlear, balance in our inner ears. There's a semi-fluid liquid in the inner ear which maintains. Most of you have by now experienced vertigo issues. So people who have
Yeah.
vertigos, don't tend to have a balance. They tend to get giddiness, they lose balance, and they fall. And the last one is joints and muscle positioning. So all this data, proprioception from the muscles, visual data from the eyes, and the inner your balance, all this get interpreted in the brain, and then there is a balance. So usually, what happens when people who alcoholics who tend to drink, what happens again? They lose their function. All this integration, the balance in the brain gets disturbed. So that is when you tend to fall. So these are the three main things. People just feel that fall, just maintaining a good physical health is important to maintain balance. It's just not your physical body or your muscle strength or your bone strength. It is equally important that your eyesight is good, your joints are good, or also your inner ear functions are good. So what are the common personal risk factors? So by now, once you're 60, see, aging is a natural phenomenon. We can't undo it. Things. The body has to age. The body has to go frail. You know, this is a very beautiful English saying that age like fine old wine. So I think all of you are with Happy 60 plus. It's doing a wonderful job. So I was just digging into all the activities what the organization was doing. So you're on the right platform to keep yourself engaged, and it's also engaging you to such activities. Hello.
Yes, please continue.
Yeah,
Continue.
yeah.
I'm
So
just
as you age, by now most of you would have had many comorbidities like diabetes, arthritis, dementia, dizziness, and many more things, and physical inactivity. So there is something called sarcopenia. So when you don't use your muscle or your bone, it again decreases its functions. So as you age, you think that no, you will not. Most of you would have been having a happy retired life. They would want to rest, and most of them will not have a regular exercise pattern. They will not do walking also sometimes. So when your mobility decreases, automatically bones and muscles get weaker. When you don't use them, it automatically gets weaker. That's how the physiology of the body is. Third thing is medications. By now, if you had any comorbid conditions like hypertension, diabetes, arthritis, or anything, the doctor would have put you on many medicines. And these medicines will cause drowsiness, confusion, all those things which might affect your balance. Poor eyesight is one of the common thing. And India is, you can say it's one of the sub capital of cataract also, because we are an Asiatic population. Get eyesight is always a problem here from childhood to old age. As people age, they will definitely have compromised eyesight, be it presbyopia, or they would have got a cataract surgery done, and it wouldn't have been 100% functioning. And one important thing I would want to stress on here is incorrect footwear. Not many of you know that the footwear what you're using is causing the fall. Loose fitted, hard or high heel shoes or anything. See, it's footwear always should have to be a comfortable thing. It should give you support and balance. And not every footwear is right for everyone. Only if you feel you're comfortable, only if you feel your walking is not altered. Most of the cases is compromised. Your foot toes will be overdoing their job in maintaining the balance. Lastly, fear of falling. As the statistics tells, 60 plus people, one of three people have a fall in a year. 80 plus people, 1 in 2 have a fall every year. Once you fall, it's again a vicious cycle. And once you fall, you hit something. There's a bleeding. They rush you to a hospital. You're on long-term medications. A lot of complications happen. And then next, you will always fear to take the next moment. Why? I should avoid my falls. So it's a vicious cycle. So all these, when the body is in a very stressful environment with all these conditions, there are risk factors for fall. So how to reduce your risk of falling? Usually, we would tell you to get regular health checkups done, eat nutritious and healthy food, stay hydrated, get at least 30 minutes of activity every day. Okay, and if you have any side effect from any medicine that you've been taking, because by now most of you would have been on long-term medications.
Yes,
And
sure.
yeah, so suddenly your HbA1c levels are not doing good, and your doctor tells, no, let's stop this diabetic medication. We'll put you on some of the medication, and he will tell you, watch for any signs and symptoms. Observe. If you find something is wrong, we'll revert back to me in a week or so. Most of you will not go back to him.
Yes,
Most of
that's
you
a boring thing.
Yeah. Most of you will think, no, my next annual checkup, my insurance checkup is after 6 months or 3 months. I will get a blood check done, and then we will take a call. So these medicines, when again, it will compromise your day-to-day activities. So you might be at a risk of fall. Lastly, you should keep your eyesight and glasses checked. How many of you get your ophthalmic eye checks once in a year?
Not regularly.
See, that is one thing. We have to, because the body is aging year by year.
Yes.
Yeah. People who are the cataract is maturing year by year.
Cataract is done, so that confidence is there.
No. People who have got it operated are on pseudo lenses. The lens is doing its fun. People who are not operated, who have an immature cataract, the cataract progresses every year.
Yes.
But the vision is not corrected. So this is when then we tend to that no, it's old age. We want to compromise our lives, but we don't have to. These small changes, small conscious efforts that we do will bring maximum benefits. Okay, these are some other tips. So if people are having a swollen foot, if they're in congestive cardiac failure, they're having a diabetic foot, any injuries in the foot, should always see a podiatrist, because foot injuries are very common in long-term diabetic patients. Now there is something called diabetic neuropathy. What happens in if you're a diabetic since 10 to 15 years, and your nerves in the distal loses function of sensitivity, and once it loses sensitivity, you're more prone to injuries. You will be stepping on a stone or something harmful, but your foot will not be sensing it.
Side too.
Yes.
What is
And
tingling, doctor? What is
yes,
tingling?
yeah, same. Tingling is also again, it is inflammation of the distal neurons. So people, he would have put you on pregabalin medicines.
Okay.
Yeah, again, when tingling happens in long term, the nerve loses its function.
Okay. Now, how
So
to know what tingling is?
again, tingling is in distal ends of the nerves. So it's called,
Yeah.
again, when any diabetic neuropathy long term, distal end of the nerves, when there's high sugar content, the nerves are getting affected. Its functionality is getting affected. Okay, as the nerves are going towards infunctional, they start releasing all inflammatory markers on, which causes your that feel of tingling, burning sensation.
Burning sensation.
Yes. So
Okay.
nerves, in term, I would say that the nerves are dying slowly.
Okay.
Micro nerves, they are dying slowly because of all these conditions.
Is it
And
the burning in the foot?
burning foot happens for a lot of reasons. If you're a rheumatic
Okay.
arthritic
It's not
patient,
tingling. That's
yeah,
not tingling.
same ways. These are all symptoms: tingling, burning. It can happen for many reasons. If your uric acid levels are high, just not be diabetic. Diabetic neuropathy is one condition.
Okay.
So it can be with, when your uric acid levels are high, when the patient is a renal patient, when his kidneys are compromised, any substance which has to be excreted in the body and still continues to be in the blood,
Okay.
causes an inflammatory response. It damages
What
tissues.
about varicose veins?
Varicose veins also. See, you're coming again. Varicose veins. That is again other physiology. Varicose veins are very common in women,
Yeah, correct.
and that to working women. Why is it common? Women tend to work with standing a lot.
Yeah.
Earlier days, cooking used to be a sitting process. People used to sit front of those, wood lit stoves and cook.
Yes.
Maybe 50 years back or 30 years back. Now, once we've had gas cylinders, when kitchens have become Italian, when everything is modern, no one tends to sit and cook. We all
Yes.
stand and cook.
No,
So
not because of the cooking now. Now I am 73. I am
Hmm.
retired from cooking, but I was working in the bank. So
See again, ma'am.
now I have the varicose veins.
Okay.
So because of that standing at that time has made me get varicose veins.
Yes. Standing, it loses veins. And I will come to all that things in the end. Standing.
Okay,
Yeah.
sure.
Yeah, definitely. As you told, these are all comorbidities. Let the session be interactive. Yes,
Okay.
teachers are more prone to have varicose veins of all the occupation. Why? Because their job is always standing and teaching. When their muscle strength, when the calf muscles are not right, the blood, gravitational force, the blood tends to pull down naturally. It has to be pushed up back. But long term, when you're standing, the pressure to push it up back will be lost. Veins will lose its functionality. And that is when natural gravity, the bloods are clotted down. And if you don't correct it in early, that will lead to further complications. So all these changes, be it diabetic neuropathy, varicose veins, flat foots, you have any fears of falling, and you're using any walking aids, your eyesight is compromised. All these things are of risk factors, but we just accept it, saying that, no, I'm old age, my eyesight is compromised, my muscles are weak. It need not have to be that way. It can all be corrected. So we just have to, give a little conscious thoughts, do the regular checkups, meet the right people, and get those things sorted. And then you will prevent your falls. So as I was telling, 55% of the falls in elderly happen at home itself. They don't tend to fall anywhere out. Well, I just want to know how many of you have had a fall in last year? Just a question. Has anyone in the group had a fall last year?
Seems no. We have a group of happy seniors. We are
That's
taking
good.
preventive action
That's
and
good.
by
And
attending this session.
yes, and if physiotherapy is also doing good. I heard Miss Meena talk also. Yes,
Yeah,
that's
that is the chair yoga classes, regular
that's yeah.
sessions.
So statistics says 50% of the falls happen elderly at home, 22% of falls happen outside our home, and 23% falls happen away from home. So this is a small video that I would want to play, suggesting the risk factors and how to correct for
Falls
Video is
are
not
common among
coming.
older adults.
Why?
You can prevent a fall by following these tips.
You can take it.
Make sure you have good lighting in and around your home to help prevent slips, trips, and falls. Hallways and areas near stairs and steps can be dark and dangerous. Install lights at the top and bottom of stairs. Use night lights or flashlights in your bedrooms, bathrooms, hallways, and kitchens for a little extra light. Keep walkways and stairs clear of clutter and items you might trip over, such as bags, purses, shoes, electrical cords, and laundry baskets. Remove small rugs that could cause you to slip or trip. Make sure that you have railings on both sides of your stairs for extra stability. The bathroom is a common place for falls. Install grab bars in the tub and shower and near the toilet if you don't already have them. And be sure to use non-slip bath mats inside and outside the bathtub and shower. Always keep a flashlight with fresh batteries next to your bed in case the power goes off. Wear shoes with non-skid soles. Avoid going barefoot. Take care of your health too. For example, you should have your eyesight checked once a year. Always follow your eye doctor's instructions for wearing your glasses or contacts. Talk to your doctor. Ask if you are at risk for falls and if any of your medications could increase your risk for falling. Also, ask how you can begin a regular exercise program to strengthen your legs and practice your balance. Falls may be common for older adults, but they don't have to be. Follow these easy tips to reduce your risk.
So this is just a small insight on how to prevent falls in your house. Yeah. So how many of you go out and do gardening? So it might be a retirement life for everyone. Most of you do it.
Yes.
Yeah. So these are a few common things that recommendations tell that don't leave things lying around your garden which are roll up. Make sure your walking surfaces are non-slip surfaces. Uh, keep clearing those fallen leaves. And so as I told you, at this age things are a lot compromised. The body is not its 100% functionality. We also have to keep that in mind and also try to correct wherever we have to make our changes. So just in case you have a fall, if actually these slides were made for all the senior living facilities. So we are tied up with most of the senior living cares. So they have an emergency alarm, they have an rising clock, something. But if at all they fall, an intimation will be sent to the caretakers there, and they will come. And in many foreign countries, there is a system like nine. In a country like US, you don't have to call the ambulance or talk to your doctor that I fell. Only thing is you just have to call 911 and just tell that I've had a fall, and they will do the rest of the things. They will send you the right people to take care of you. The right hospital things will be notified about your fall, and all those things will happen. But it's not the case in India. We can't blame it. This is the country we are living. Things are going towards the betterment. But if at all we fall here, there is a lot of big process that we'll have to do. First we ourselves will have to call the ambulance. We'll ourselves will have to remind our doctor. Get all the previous health checkup reports, any past surgeries, past medical history, discuss with them, and then go ahead. Where in many modern countries, your healthcare data is already set there. So let's hope something like this happens in future also for the elderly. There's a small video on how to get up yourself from this. Is a WHO recommended video. If at all you fall, and how do you get up from this fall? We'll be sharing these videos with your team also. Hema, you can send this across your WhatsApp groups also. I'll tell Bhargav to share it.
Yes, yes, we'll do that.
We're playing this video.
Here I am, I've fallen on the floor. How do I get up? Okay, primarily your objective is to get up without injuring yourself any further. So upon falling, once you've composed yourself, you want to do a head to toe assessment. Kind of look over your body, look and feel if anything is broken, how badly you're hurt, and then attempt to get up. What you're going to need to do is get over onto your belly. So if you're on your back, try to roll and get onto your stomach. Okay, if you experience excruciating pain and are unable to do so, don't try. Okay, at that point, you'll need to summon help. We can talk about that in a minute. But once you've gotten over onto your belly, if you're able to do so, you want to take and start out with your good leg and your good arm and try to get them underneath you. Then get up to your hands and knees and crawl. Don't try to stand up without some kind of support mechanism. Move over to a chair, a set of stairs, a coffee table, anything that you can grab hold of, and then work yourself up, always maintaining 3 points of contact at least. Bring over, and then pick yourself up. Use your good leg. If you have a bad knee, keep the bad knee on the floor. Even if that hurts more, you want to have the good knee underneath you. Pick yourself up and turn yourself into a chair. Once you're up in a chair, you can reassess the situation and then see if you're able to walk away.
So this is what the WHO recommends. If at all you have a fall, this is how you have to, because there he's maintaining 3 points of contact at any moment. So that will give you a maximum support. At any one go, no one will be able to remember this and try to follow it. So we'll be sharing this video. Any minute things, this has to go in an incognito mode. Unconsciously this action has to happen. When at fall, you'll be a lot of pain. There'll be a lot of other things happening around. But this has to become a natural process. If at all you fall, this is how you have to get up. So over the time you're familiar with this, I think it should not be a concern. So in our elderly cares, people are trained for this actually. So overall summary, I would say stay active, exercise daily, manage your medications, have a safety home checklist. Always an elderly care should be very cautious. If there are a lot of children in the house, they have their play toys, which are mobile, all the small cars and toys, which might prevent, cause you falls or make you slip. All those things has to be taken care of. Stay alert when you're outdoors. If you need a walking aid, please use it. Don't feel shy for it. Okay. And always have an emergency plan. If not a false alarm like in any foreign countries, or a watch or a digital watch or anything, keep your phone intact with you. Keep those emergency numbers in your checklist. You just have to press 1 or 2 buttons. The call goes directly to the people concerned. So the concept here is, see, you might tend to fall. Even if at all you fall, how do you manage it? And how good can you manage it? Now here we are coming to picture where we want to prevent yourself from falling. That's how I'll be telling you. So Hema, is this risk score being sent to everyone? Hello?
No. It has not been sent. We will.
Okay.
You can send this to us. We will send it to them, and based on the results, if someone wants to go ahead with some Freedom to Fall program, we will go ahead.
Okay, sure. Yeah. So this is actually a WHO guided, risk for fall self-assessment risk score. So we'll be sharing that. We usually share it with any camps we do with any elderly care. So we ask the member to tick, be very honest with it. Just these are few questions related to your history of fall, balances, any medications that you're taking, all those things. So, and if the score comes above 4, you're at a risk of falling. Okay, 4 to 8 is called serious risk. Anything above 8 will definitely ask you. You're at a very higher risk. There are a lot of corrections that has to be taken care of, and we'll be guiding you accordingly. So we'll be sharing this with Hema, but I think she'll send you out. So please tick and please write down your age, phone number, and the score what you've got it. Just be honest with it so that you will also have a conscious awareing of what range are you in that risk of falling. Okay, so program per se, freedom from fall, this is all the inclusions in the program. 1 second. Yeah. So why is it important that we have a specific program for falling? See, if you go to an OPD basis or in any elderly care OPD setups where they will particularly not monitor anything for your risk of falling. They will check your calcium and vitamin D levels. They will assess your functions, and they will just any doctor in an OPD in any multi-specialty hospital. I don't want to name, be it Manipal, Kulam, any hospital. They'll just tell you that try to prevent your fall. Injury should not happen. They'll just tell you. Here, what we're assessing, what are the things that we're assessing is we have something called SECA. It's a comprehensive elderly care assessment where we do a physical examination, we do your cognition and depression test and urinary function test. Why do we do an urinary function test? Because at old age, urinary incontinence is a very big issue. So I just want to ask, how many of you get up in night to void?
I do get up.
Yeah. Multiple times, or is it 1 or 2 times, ma'am?
No, some days it is more, some
Yeah.
days it is less.
Yeah.
Most
So
of the days it is
There
more.
are couple of
And my
times.
sleep also gets disturbed.
that's the thing. So again, it's a vicious cycle. So the statistics says that maximum of the falls happen in elderly when they get up to void in night.
Yes.
Yeah, because why? They'll be, they will not be completely cautious. They will be in an urgency to pass. There'll be no proper lighting, and your senses will not be 100%. So that is when, and all these things, and when you have an urinary incontinence issues, you have a bladder problem. With men, probably with men above 60 are very most of them will have benign prostatic hyperplasia, BPH. They'll have problems with their prostates. They would have got them surgically removed. They'll be on medicines for their urinary bladder strength. And when you wake up multiple times, as you told, you're having sleep disturbed also.
Yes.
Vicious life. 1 day of sleep, again, it will affect you 3 to 4 days of sleep.
Yes. No,
And
even though I compensate in the afternoon,
Hmm.
again the cycle, because I have slept in the afternoon, night I will be awake. Again that sleep, again the next day afternoon I will sleep. So the circle keeps on going. I don't know how to disconnect that. Unless otherwise I am awake throughout the day, probably I will sleep well in the night.
So that is the thing. So what we want to see is, if at all there can be something corrected, we will assess there. There's a urinary function assessment also, what we do in SECA. Okay, there's a questionnaire where we see with your medicines, is any of the medicines what is causing you excess urination? Do you have to change your medicines there? Or if you're all, there is any bladder incontinence, how do you correct it? Do you have to go to a urologist? What are the tests that you have to done? All those things will be told by us.
Sure.
Okay. And second is calcium and vitamin D test, what we do. So how many of you, do all of you get your calcium and vitamin D checked yearly?
No.
Okay. But most of you might be on irregular medications with calcium and vitamin D. Some take
Multivitamin tablets.
Yeah. See, that will not be giving the amount of calcium that it has to also. So you will not be knowing how much calcium the body needs, how much vitamin the body needs. Vitamin D to most of the elderly. Even I take vitamin D supplements. Until I found out that my vitamin D levels were low, I was not aware of it.
I'm not able to see myself in the video. Why it is so?
Sir, I think, you blocked your camera, I think. Is the camera on or off? Switched off? No worries. You can see the presentation, sir.
Can you see the presentation, Santhanam, sir? Okay. There is a video icon if you're on a phone or on the laptop. Down below, just touch it. And right now, there must be a cross. When you touch it, that cross will go, and then you will be visible in the video. I think Uncle can hear it. So let's go ahead.
Sure. Yeah, sure. Okay. So again, we get your calcium and vitamin D checks done. If at all you need some because again, calcium and vitamin D go hand in hand. If your calciums are low, your vitamin D will be low. And if your vitamin D is low, obviously from the bones, the calcium gets resorbed into the body. The body needs calcium and vitamin D both. So if these things are not taken, and it has to be monitored on regular interval of time, and if it's not taken regularly, it will affect your definitely your bone strength. And there's something called bone mineral density test we've done. Has anyone of you got it done by now? BMD, who are at risk of following osteoporosis? BMD test done? Okay, no worries. So, has anyone of you got a hysterectomy done? No worries. I don't want to know the names, but if at all you've
Yes.
got an hysterectomy, yeah, ma'am, you've got it done.
Yes.
Yeah. So, if at all you've got an hysterectomy done, you'll be more prone to osteoporosis. I think the doctor would have told you before only.
No,
Because
I
the
have
hormonal-
undergone a total knee replacement.
Also.
Yes.
Yes. See. You know why did you end up there? Because again, there's this hormonal thing which affects your calcium deposition, and
Yeah.
the osteoarthritis is faster in your age.
Yes.
Yes. So this we get your bone mineral density done, and this will assess is your bone strength up to your age? Is it the right mark? We will see the standard deviations. This is one good test where we identify the risk of the correct bone strength. And so we will tell you if you're at a higher risk, what are the things that you have to do now, and what are the medications that you'll have to take. Because there will be some long-term medications that we'll be taking that will be losing us calciums, that will be losing us other microminerals that we'll not be knowing. So this test will also it's an ultrasound guided test. This test will test how healthy our bones are.
Okay.
And lastly, we have something called PhysioSmart of the knees. Okay, this is an AI based device which we tell you to put it on your knee joints, on both the knees, and our physiotherapy team will come to you and once they tell you to wear it, they will tell you to make some actions, maybe walking, sitting up, get up, flexion, extension of the knees, and this device will record the motions in your joints, in your knee joint. Can I continue?
Yes.
Yeah. So this PhysioSmart device, it's a wonderful device. It's an AI-based device, and they'll give a complete report because not everyone will have the same problem. They might be of the same age, they might be consuming the same diet, they might have the same medical condition, but the body ages differently, and their knee health, and that will assess what some will have gait imbalances, some might be limping, some will have problems with their muscles in the thigh or in their lower half muscles. So this PhysioSmart device will tell exactly where the problem is with your gait and what are the exercises that you will have to do it to strengthen those organs involved. And lastly, we also have an ophthalmologist who checks your baseline eye exam. He checks for cataract and glaucoma. If at all there's any requirement or any further consultation, he will recommend you, and we'll also be assessing the same. So analyzing all these reports, be it your elderly care assessment, calcium and vitamin D test, bone mineral density test, the PhysioSmart, and the eye testing, we give a detailed report. So this report, and we will grade you, and this report will be given to you. You can use this throughout your life. So if at all you go, I'm not telling you have to experience a fall. The doctor at all, the moment you take and give this report to you, he will assess what medicines I have to avoid.
Can I get it done at Surat? I'm
Uh,
in Surat.
Surat, ma'am, that I would have actually. We are also placed outside Bangalore. We are in Pune. That I'll tell my, the corresponding team to coordinate with you. So you can get the blood checks done or any tie-up institutes there. We can ask them to get those checks done and we can review the reports. So I'll get my team in, get in touch with you.
Okay.
Yeah. So this report we give it, and this report will have your throughout history. What is the concern? Is it his joint issues, or is it his visual problem, or is it something with the muscle strength, or is it the medicines that they're taking are causing? So henceforth, if at all you go to an OPD care or a future doctor, he will know. So these are the medicines that I have to avoid. These are the things that I have to look in for first. And we will also advise you. Our fitness advisor is there, Roshan. I think he's already on the call. He'll be teaching you a few exercises now. Few general exercises. He'll be discussing you about how to take this ahead. Okay. So, and we will be telling him what the PhysioSmart of the knee will be telling what are the exercises that you'll have to do, because not everyone requires every exercise. Usually what happens in a day-to-day physiotherapy or a routine process, everyone will be taught the same exercises. But everyone's body would not have aged the same way. Everyone's bone density, everyone's knee strength, gait would be different. Some people might have got operations. As ma'am told, she has a TKR. Many would have got different operations. Some people would have had fractures before. And all this analysis we do and we tell, these are the exercises that you have to do to strengthen these things. Correct your medicines here. Then you will come from a higher risk to a lower risk, and eventually you will start getting better and you will prevent your fall. So the presentation ends here. Any doubts? I'm free to answer your doubts.
I'm Santanam,
Yes, sir. Tell me, please.
speaking from Bangalore.
Yes, sir.
I was very, not to mention that I was a very smart walker, doing my walking. I was a good swimmer and a cyclist and all that.
Yes,
It
sir.
was all a story of about a couple of years ago. Today, I'm not able to even make about 500 meters of walking without some support of some assistance. I am now 76. What could have been? I have not undergone any operation or knee or any surgery or anything else.
So can you switch on the video if at all? I can get a little information on how you look also. Nothing else.
I
No
don't know
problem.
how to. I'm trying.
Okay, no worries, sir. No worries. So as I told you, sir, there are a lot of things
So-
involved.
Yeah, I was just trying to guide uncle. From where he unmuted himself, there would be a start video thing where you can just touch and see the video will be possible. But if it's not possible, it's okay. Go ahead, Dr.
Okay.
Nishchal.
Yeah. Santanam sir, so you don't have to worry here. So there are a lot of things that get involved. When you're 76, you might be taking many chronic medicines also, and there's something called osteo.
I am a cancer survivor for last 7 years and taking medication for that. No operation, nothing, no surgery, no chemotherapy, nothing has been done. But I was very active till last year, very active till last year. But now of late, to make even about 500 meters of walking, it requires a great effort. And I have to sometimes look for my children to help me to take me out. Earlier I was going all the way anywhere in India, but today I am only confined to my colony. It's okay. I accept this as part of my life, but I don't know why it has happened to me. Okay.
Yes,
This is
sir.
what-
Yes. But
Yeah.
you don't. You also know that aging is a natural process, but you don't have to accept. There might be something that you might be missing on. There might be a sarcopenia, as I told you, the disuse atrophy when you don't use your muscle, and it's causing it's disturbing. The muscle, the bone automatically gets weak. You might have not got your vitamins or calcium levels checked recently. Okay, and the medicines that what you're taking might have an effect on all these things also. So when we do this test, we will want to assess all these things, and then we total it out, and then according to you, what personalized care you require, because now it is bothering.
What type of test should I undergo for getting my either bone strength or what is a sort of imbalance in my walking?
Yes.
Earlier I used to walk straight and up very fast. Now, if I walk for a few minutes, I have to wait and balance myself, then move. Is there any test to
Yes,
see?
that is the thing. The test what we are giving has everything. It is a complete evaluation with your blood checks and with your bone mineral density, and with those PhysioSmart, it will tell what are the joints that is getting affected. So just by the call and just by the history what you're telling me, I will not be able to assess.
I agree with you. totally agree with you.
Yeah,
Can you, as I said, I am in Bangalore,
sure.
Sarjapur Road. If any of your technician or executive could get in touch with me, I'll be
Definitely.
happy to.
The back end team, I think I'll tell Bhargav to get in touch with you. He will send, because
Mm.
we cater to many of the elderly care organizations. Last week, in fact, I was in Whitefield in Kadagodi, I think, with the Suvidha Elderly Care Center. We got a camp
Okay.
done there also.
Doctor,
Atashi,
can I ask you the next question, please?
yes,
I'm
ma'am.
Manisha.
Yes, yes,
Okay.
yes, yes.
Yeah. Doctor, actually, the first question is that actually I am a patient of osteoarthritis, and I had a balance problem because of vertigo. Now my vertigo is okay, but I fell quite often. But this thing, I want to ask you about this brain getting anemic. There's this concept I heard, and like this happened about 5 years ago in winters. I was taking a walk in my society compound, and then I suddenly remembered I had to, see a neighbor, and she used to stay on the third floor. So, without stopping for taking a few breaths or anything, straight after my rounds, I climbed 3 flights of stairs. So, what happened? I think my brain got anemic. I think the blood didn't rush to my brain. I don't know, you would know the medical terminology, but I just know as a layperson what the. So when I put my leg up to, luckily it was the last stair. So when I put my leg up to reach, I just fell because I think the instructions didn't reach the brain. And I just fell flat on my stomach and I sprained my right arm. So, is this avoidable? Like suddenly this thing, what's it called? The instruction doesn't reach the brain that I have to climb one more stair. So how does this work, doctor? Because I was really alarmed. I didn't slip, nothing, but I just put my leg up to reach the final stair, and I fell very badly.
Are you a long-term hypertensive patient, madam? Are you on any medications for BP, hypertension?
Just a minute. I started. I don't know whether you call it long term, but I started on medication in 2010, about
Okay.
13 years ago.
So when did this fall happen?
This fall happened on 19th of January. 19th of January 2019.
Okay, so 6 to 7 years after you started taking your medicines.
Around 8 years after I started
Yeah,
taking my
okay. So
medicine.
see, as I told you, there are a lot of things. You already have a vertigo issue which affects your vestibulocochlear inner ear balance. There's a balance that is being maintained. If you're a vertigo patient, you don't. The ENT doctor would have put you on some medicines. He would have also taught you some exercises to do when you were
For
taking.
vertigo. For
Yeah,
vertigo.
he would have taught you when.
Actually, isn't this linked with cervical spondylosis, doctor?
Yeah,
Because
as I told you, this is just not fall in elderly doesn't happen just because of one cause. To maintain balance, as I told you
but
again, I think
in 2019, I wasn't even 60. Right now, I'm 62. So I wasn't, I mean, I'm not saying it out of vanity, but I was, I must have been, how old? I can't remember.
it's not the
55.
age, ma'am. Again, I'm telling you, it's not the age. The physical age of the body might be different. Everyone might be pursuing. Some people will not get into diabetes or hypertension throughout their lifetime.
But doctor, sorry, you don't understand Hindi.
No,
You said,
बोलिए मैम उतना तो पता है हिंदी.
I'm more comfortable in English.
That's
I'm
that's
an MA English. The thing is that is this true that the brain gets anemic? Like the brain, why is it that my leg was wanting to climb the stairs, but it didn't? Because the message didn't reach the brain, right? The blood didn't reach the brain because I had walked so much together and I climbed 3 stairs of 3 flights of stairs. So is it that something to do with brain getting anemic, that the blood didn't reach the brain? That's how I felt.
Ma'am, it's per se to tell, I will tell you there's nothing called brain anemia. Okay. So I will tell you
Okay.
how things, yeah, there is nothing like brain anemia. There are many things that have got involved at that you, for the history, what you're telling, you walked for a lot of time and suddenly you started clearing steps. Your lower limb, your leg muscles would have got fatigued by then. You're also an hypertensive patient. You've climbed the stairs very fast. You also have a vertigo
Not
patient.
very fast, slowly,
Okay, yeah,
because
you
I've got.
climbed
I climbed
and
slowly. I never
yeah,
climbed
and
stairs
yeah,
fast.
so you did this after a long walk.
Not a very long walk. Must have been just 10 minutes.
Yeah. See, this is the thing where it comes to. It might be because you might have lost balance because there's muscle fatigue in your limbs also. When you hold anything
Acha.
for, yeah, muscle fatigue in your limbs because you would have, and you're also a hypertensive patient. So
Hmm.
and there'll be BP fluctuations. Postural hypertension is there. When you're climbing stairs, BP will be on a higher end.
Okay.
And but the muscle would have got fatigued. This is just not one condition.
Okay.
So this is what I'm telling. Fall does not happen just because of one cause.
Okay.
When you age, there are a lot of things that get compromised.
Doctor, I fall a lot. That is why I was very keen. I was waiting till 3:30 से मैं wait कर रही थी for this
No worries.
webinar,
We'll
and I
send
didn't
you
want
that.
to be late
We'll
because
send
I
you that.
fall a lot. Hmm.
Yes, ma'am. We'll
And
send you that
some of it.
self-resistance.
Actually, doctor, one more thing. I've
Yeah.
got osteoarthritis. It was diagnosed in the late 90s. So, around 25 years ago. But I was a working journalist at that time and used to do a lot of walking. So, my arthritis didn't really become very serious. But now, sometimes I don't take regular walks and, but मेरे को एक बात बताइए कि see, my elder sister got her knees replaced. My mom was osteoarthritic, but she never got a surgery. She passed away at age 80. But tell me, doctor, the past 1 year, I've been having knee pain. And I do my knee exercises. I learned knee exercises. One video Sunita had put on her group, which I do every day, and I've learned some some other exercises from a physiotherapy therapist. So, is it okay to stem the rot? Because I'm getting very worried. I'm 62 and I don't think my knees are in a condition to be replaced because they're not so painful. But मेरे को एक और बात पूछनी है, my ankles also have started hurting and my wrist sometimes pain. I got a rheumatoid arthritis test done and that tested negative, it was well within range. So ये wrist तो small joints में आता है ना?
Yeah, wrist is your
So
hand joints, but not necessarily rheumatoid arthritis. You see, as I told you, you're going dedicated to searching for one thing. What is there? It is not just one thing that will cause a lot of all these things. So the whatever the exercises that you've been doing need not be much beneficial to you, because until we assess
oh,
what is the damage there, yeah, because it's a
oh.
generalized exercise. But your body doesn't age a generalized way. Not everyone's
But
joints
doctor,
are.
the pain has got reduced after I stepped up my exercises, and Art of Living also taught some knee exercises. I did a 3 months course from there. So my pain has stopped. But because of the rainy weather, the past 2-3 days, because in Delhi, you must be in Bangalore. In Delhi, it's very erratic. It rains very heavily suddenly, and then there's a lot of humidity. So, doctor, tell me, I take homeopathy, and sometimes I take a Paracet. My stomach gets upset with heavy painkillers. Once a doctor prescribed some very heavy painkillers, and I had severe loose motions, and I was very ill. So I'm very scared of taking heavy painkillers, and I avoid them. But doctor, मेरा ये ठीक हो जाएगा ये मेरा, because
Yes, ma'am.
somebody told me, हाँ.
There's a lot of medical history here that we will be that will have to be assessed, and the right things to be
Okay.
advised. Just over the call, yes, this will definitely get better because we will be pointing out the black spots here. Over the call, I will not be able to tell you what is the thing that
Yeah,
you have to
yeah,
start.
I
Yeah, so
perfectly appreciate that. But
yeah,
since you were taking questions, I thought I will
no,
also
no, it is good because it
not
is,
hesitate
yeah.
and take advantage of your experience and wisdom.
No,
So, taking walks, apne ka activity hona chahiye. I do my yoga every day. I do my pranayam, and sometimes I would say activity is a little less. Like like today, I'll be skipping my evening walk. I usually leave by this time, so I'm a little scared of walking in the dark because I've had some, wrong step pad jata hai, so I don't leave my house in the dark. I'm very, very scared. Are there any precautions? You've already mentioned the precaution. So when you say you can't stay on call, so what do you suggest? You must be in Bangalore, no?
yeah, I'm in Bangalore, ma'am. So I would suggest you get the test done. We will give you a completely evaluated report assessing your bone strength, the medicines required, the medicine that you're taking, the PhysioSmart, it assess all your knee
I,
functions.
I used
Once,
to take
once
vitamin D twice a month,
no,
but then I just got my.
without assessing your blood reports, I will not be able to tell you anything. It's just not the blood
Mere,
report.
doctor, I just got my blood reports. Everything is fine. Even my vitamin D is fine. So my doctor said take Lumia just once a month, and everything else is fine. RA also is negative. So,
RA is
doctor,
negative.
what is?
अच्छा डॉक्टर साहब
Sorry,
मुझे भी कुछ कहना है डॉक्टर साहब
Yes,
एक
sir.
second. Just a minute. I'm just finishing. You look very familiar. Are you Asha Basu?
Yes, Manisha.
Oh, hi. I just recognized you because I just finished, Auntie. Then you can ask your question. So, doctor, just tell me once that where what do you what are you saying I should get done?
Ma'am, this freedom from fault test is a comprehensive test. There's an elderly care
Okay,
assessment. We assess your
okay,
medicines. We do your blood checks. There's a physiotherapy assessment by the PhysioSmart device, and assessing all these things, we'll tell you what are the things that is causing you for a risk of fall, and what
okay.
are the things that has to be corrected.
So,
So as I told you,
is this the assessment that Sunita was mentioning that we have to fill up the assessment form?
no, the assessment will just tell you what risk are you at a fall.
Acha,
Okay.
acha.
The test will
Uh-huh.
tell you what are the wrong things and where are the corrections that you will have to make it done.
So, where can I get this test done, doctor?
My backend team will get in touch with you.
Back-end
Yeah.
team.
Please,
Can
I will ask Bhargav to
just,
stay in touch
just
with
a
me
minute.
and
Just a
help.
minute. So डॉक्टर उसमें कैसे होगा ये ईमेल पे या फोन कॉल पे कोऑर्डिनेट होगा?
Bhargav, would you want to join?
Ma'am, I would like to speak. I'm Sunita. So this is basically a awareness generation that this kind of tests are available.
Okay.
And Mr. Nischal is going to give first the review assessment test, which all of you will take on your own. You will then come to know whether you are at a risk of fall or not. And based
Okay.
on that, on your number, I think 4 and above, if it is there, then the
That
test
same
will
questionnaire
be
that was okay. And based on that, yeah.
then they will, if it is more, if the risk of fall is there or whatever, they will then say that freedom from fall is a comprehensive program. It includes
Okay.
the blood test, the gait test, the everything, BMD and all, which all need
Okay.
to be done. Now the thing is that you are in Delhi, so you will have to get those tests done over there, because in Delhi they have a tie-up, Dr. Nischal and his team. So they will let us know where you can get them done, and we will let you know. Or we can
Acha.
connect you directly with someone. Okay?
Okay.
I will
Sunita,
connect directly.
will you be kind enough to send me the contact details of Mr.
Yes.
Bhargav?
Yes.
Okay.
Yes.
Okay.
I will.
Thank you so much. Thank you.
Thank
Auntie Abba, please boliye. Sorry. Hanji.
Sunita, contact details of Dr. Saab should please send it to me also.
Yes.
Dr. Saab, I am a cancer survivor.
Yes, ma'am.
Recently, I had a major surgery done
Okay.
और अभी कीमोथेरेपी खत्म हुआ है
Okay.
इन अप्रैल। तो मुझे तो मतलब घर में तो मैं चलती रहती हूँ
Okay.
और बाहर मैं नहीं, घर से बाहर नहीं निकल सकती, बिल्कुल डर लगता है।
This is the thing, ma'am. वही ये आपको डर क्यों लग रहा है?
बस गिर जाऊंगी।
So that is the thing. अभी हम इधर ये टेस्ट पे ये बता देंगे आप कहाँ चेंजेस लाना है, कौन सी एक्सरसाइज किया तो आपका मसल स्ट्रेंथ, बोन स्ट्रेंथ ठीक हो जाएगा. What are the interventions? Do you have to get your eye checks done, or should we start you on any medicines? Should we start you on calcium and vitamin D? ऐसा हम किया तो आपका वो डर कम हो जाता है, क्योंकि आप मजबूती हो जाता है. You will be on a better end. So now you are not addressed the problem. You are just staying away from the problem. Thinking that if I go out, I will fall. Now we will be assessing that why is that you have a higher risk of fall, if at all you have, and what are the things that you will have to be doing according to recommendation. What are the exercises that you will have to be doing? Our fitness expert now, Roshan, will be joining. He will be teaching you few exercises. He will be discussing.
Please.
Yeah. So all
Doctor,
those things.
one thing. Hello.
Yes. Yeah.
Doctor, one thing in Bangalore, where can we locate you?
We
Which
have
place?
a health hub in JP Nagar. So that is our Bridge Health's main office.
Anywhere near Whitefield?
See, our team will get in touch if at all someone is getting a test done or something. So we keep doing this checks done with elderly resident organizations who are particularly. So once there is a camp, something like that, our team might ask you also to come there. So we get all these checks done, and then once at all for a consultation, they will call us. All those things can be organized.
Because JP Nagar is very far for that. Is the
JP
reason.
No
Nagar is the health hub.
worries. Whenever we get a camp done anywhere, we will also update you.
No, I would prefer to go individually rather than go in camp. So
Okay.
that is the reason I was asking if anything near
We will
Whitefield or
connect you, no
Marsali or
worries.
yeah. Okay. Thank you.
Yeah.
So
Any other doubts, ma'am? I would just want to know.
No.
Okay. So this is the thing. So it's a comprehensive, diagnostic prevention test where we will.
Health Care Manager. How are you doing? Yes, sir. So your diet consultation was pending. That is the reason I've called you to know when are you available next so that we can schedule it accordingly. Sir, tomorrow we are available from 9:30 to 12:30. If you can.
hello.
Sorry.
I think
Tomorrow the
I
slots
don't
are
know.
full. We are available on Monday, 9:30
Jayashree
to
ma'am, please
12:30, and
mute
in the evening
yourself.
time also.
Uh,
Evening post
Vinay?
8 o'clock.
Jayashree ma'am, please mute yourself.
Okay, Monday is fine. Okay, so evening time is also.
Sunita, will you be putting this on YouTube, please? Because all the slides and all are difficult to remember.
Yes, we will.
No, we'll be sharing the slides, all the videos with you. No doubts with it. Our backend team will be getting in touch with you with respect to the self-risk assessment score also. So all of you fill it honestly and then get to know your score. If at all you're at a higher risk, please reach us back. We'll be telling how to help you out with it. Okay? Sure.
Okay.
Roshan, are you there?
So, Roshan, are you there?
Yes.
Yeah.
Okay, wonderful, Roshan. We have all been waiting for you. And Roshan is a senior exercise consultant with Bridge Health, and he will be enlightening us with his knowledge of diet, nutrition, and exercise, which is needed to prevent falls. So, yes, Roshan, over to you. Great to have you on Happy Citizen.
Thank you. Hello, all. Good evening. Let me see. Am I audible clearly? Let me know if I'm not audible as I speak, okay? Because I'll move and do some movements. So you have to be interactive with me. So I understand that am I clear to you or not, okay? Are we good to go? So I will begin by addressing certain questions that I was seeing when you were talking with Dr. Nishchal. So I wanted to contemplate, I thought I would speak in the last, okay? So one of the question was by ma'am Manisha Jain. She was asking about the condition where after climbing 3 stairs up, she felt that condition where, a kind of a brain fog, okay? So, or a blackout situation, okay? This can happen to anybody irrespective of the age because there's certain science behind this, okay? There's, of course, medical conditions involved, but there's a different discussion altogether. But looking at it from the physical body and the muscle standpoint, I have few inputs that I want to give you. So in situations where you all might come across this in your lifetime, where you're trying to maybe climb stairs or any activity which requires larger input from your lower extremities, okay, from your lower body. In such situations, what happens is, for example, in this case, climbing the stairs, okay. So what happens with age is we lose muscle like every year after 40s, 3% muscle is lost, okay. So muscle lost means less functionality of the body. So with less functionality, you know, what happens is the load on your heart is predominantly higher, okay, because of less muscle right now. So unless we do certain exercises or be active, the muscle density cannot be maintained, okay, for long term. That is why in situations like this, when you do rapid movements or suddenly when you try to do any activity which you're not used to be doing, or any intense routine, or intense in the sense this stair climbing for 3 stairs, okay, in these situations, what happens? The blood flow will go to the target muscle. So in this situation, it is going to the lower extremities because you're climbing the stairs, right? So when you're climbing the stairs now, all that blood will rush to the target muscle to help you do that activity. But when it happens suddenly and your body is not used to such activities happening, on a daily basis, that load is too much, okay? Because of the sudden rush, you can feel a certain sensation of blackout, and you might tend to fall also because of that condition, okay? So this can happen to anybody of any age group, because we see this happening in the normal gym setup also, where our students lift something really heavy, which causes the blood to rush to the lower extremities, and they sometimes collapse. And these conditions have been seen, okay? So to prevent these conditions, I would suggest that we include more activities where the lower muscles are, activated and in a regular basis, which will teach our body and teach plus help us improve the muscle density in our lower extremities, preventing such conditions to a larger extent, okay? Now, moving on towards the concept. Today's
Thank you, Roshan. Thank you.
Thank
you for the insight. Yeah.
Thank you. So moving on towards the freedom from fall, right? So now I want you all to interact with me so as much as possible, okay? I can't see everybody, but I will try to understand what's happening there. And please feel free to ask anything if you feel like you want me to address upon, okay? So let's start with basic things right now. So what happens while you're falling, okay? First thing is panic, okay? There's a sense of panic in your body. You panic and you don't know what to do now, okay? So it happens very quickly. So your body, you don't know, but what's your first line of movement? Anybody can answer this if you feel like. What's your first response? What do you do when you're about to fall? Anybody? Anybody who wants to answer this?
When you're about to fall, Manisha speaking, you try to extend your hand to grab a support, a wall.
Brilliant.
Yeah.
Yes, brilliant, ma'am, brilliant. Definitely, you're gonna try to grab a support, right? So what happens? What happens when you're trying to grab a support? So your grab means your grip strength should be really strong, right? If you don't have a strong grip, what happens? Whatever you grab to, your hand will slip away, right? Doesn't that happen? So in the program, we have something called as the hand grip dynamometer, okay? Which helps us to gauge your grip strength, okay? How strong the grip is. So based on that, we can give you simple exercises, or simple as seen that smiley balls, right? Which are easy to squeeze. The smiley balls, which are the smiley face, yellow color, right?
Yes.
So that's simple balls also you can just hold in the hand and grab, squeeze throughout the day to strengthen these muscles in the hand, right? The forearm muscles, right? So they help you in gripping things. So these small
For how many minutes should one squeeze that ball? I have one at home for the exercise of the hand.
Yes,
How many minutes?
you could start by doing it for maybe 30 minutes. If it is too hard, you can just split it into 10 minutes set. Means you can do it for 10 minutes at a time, then take some rest and try for 10 minutes more. So in a stretch,
Okay.
30 minutes a day.
So just squeeze and unsqueeze, squeeze and
Yeah,
unsqueeze.
squeeze
Okay.
and unsqueeze. Okay. And
Okay.
then, so that was about the grip strength. Okay. And it's really important we have this functionality throughout our aging process from young to elderly. Okay. Everybody must have this active in their body because this is a main source for survival. You need to have grab things and manage things around you also in a day-to-day basis. Okay. Then coming on to the upper body strength, right? So you grab onto something, but your upper body needs to have the sufficient strength to help you cope up with that kind of a fall because your body has a certain amount of weight, right? So you have a certain body weight and you have to hold your body weight in order to prevent that fall. For that to happen with the grip strength, you now need upper body strength. So to have upper body strength, I will show you one simple exercise today. The program has many exercises, but today, just for the intro, I am just showing you one of the exercises and making you understand the benefit of that. Okay. So as simple as it is called as the wall push-up. Okay. A very simple exercise done towards the wall. Okay. I will show the execution back there, but first I'll explain you and I'll show you that. Okay. Because the moment I go back, my voice may not be audible. So I'm just first explain you, then I'll show you the movement. Okay. Yes. So simple understanding. First, you need to place your arm in the chest level. Okay, this is your chest level. This would be your shoulder level. We want it in your chest level. Based on your height, how tall you are. Based on that, place on your chest level first and place it on a wall. Okay, a plain wall at your house. Okay, place your hands on the wall. Okay, once you place your hands, only then slightly step back from the wall. Okay, first be really close to the wall, then slowly step back and stand, placing your hands on the wall. Okay, after that, after you place your hands on the wall and you step back, now gently move towards the wall. Okay, and push away from the wall. This is the wall push-ups. Okay, you're gonna go towards the wall and gently push away. So simple movements, you don't have to try really hard. Just do how much is possible in the beginning. Even starting with 5 counts also is a really good start. Okay, so starting with 5 counts and slowly improving that counts as you progress. Okay, maybe 1 extra count a week. You can slowly add up on that and challenge yourself. So as you challenge the body has a purpose now to hold on to more muscle, right? That is what we want. We want to retain the muscle. That is the goal. To retain the muscle, what we need to do? Small movements. Small movements now against the wall, push. And the more you challenge yourself, the more muscle you will retain. That is and also some muscles you will definitely put on to, but may not be much, but definitely some muscle will increase in your body. Okay. Now, just for demonstration purpose, I will just show them. Just watch it, okay? So what we need, we go back here, and it's pretty far now, okay? So you're standing in the wall, place your hand, stand at the back, go towards the wall, and push away, okay? So it's just that much. Standing against the wall, placing your hand, and just gently pushing away. Am I clear with this? If I'm clear, just give me a thumbs up. It'll help me to understand. Okay.
You can go to the side wall and do it. It will be more.
Okay. I guess that wall is visible there, right? I'll just do that.
Yeah. Go to the side wall.
Yeah. Thank you. Yeah. So this is good. Yes. So I place my hand first now.
You are not visible.
Not visible?
Yeah,
No.
visible.
Visible. Okay.
Okay. So I place my hand, okay, in my chest level. Then I have standing slightly away from the wall, okay, slightly away from the wall, and then I gently move towards the wall and push. Gently move towards the wall and push. Okay. Yes. So that is the movement. It's a very simple movement, nothing complex there. You're standing and just pushing. Now, if you talk about the breathing, this is also an important component while you do such exercises to make sure you don't end up increasing your blood pressure if you're a hypertensive person who has been through these conditions before. Okay, in such cases, make sure it's common to all. Everybody should follow the breathing, but it's really beneficial if hypertensive also to not increase your blood pressures. Okay, so the movement is simple. So as you're pushing away from the wall, make sure you're exhaling out. Okay, as you're pushing away from the wall, you're exhaling out, and as you're going towards the wall, you're inhaling. Inhale as you pull to the wall, exhale as you go away from the wall. Okay, am I clear?
Inhale.
Yes.
Yeah.
Yes. Asha ma'am, are you trying to tell me something?
You're
I guess
on mute, Asha ma'am.
Yeah.
Please tell again.
Yeah, sure, definitely. So this is the wall right now, your hand is on the wall. Now, as you push away from the wall, exhale out, okay? When there is maximum effort on the muscle, which is while pushing away, that time you have to exhale out, okay? So when you're going towards the wall, you are inhaling. So you
Yes.
inhale, yes, and you exhale as you push.
Yes, understood.
Hope I'm clear?
Yes.
Yes, thank you. Yes. Now, moving to the next. So that was strengthening your upper body a little bit after the grip strength. Now going to something to do with the core muscles, right? So what does the core do? The core muscles help us to balance our upper extremity and the lower extremity. Okay? The upper half of the body with the lower half is bound by the core muscles within. Okay? Now, what happens when we don't have core muscles is, in case, in situations where we are about to fall. Now, in case, okay, for some reason, I am about to fall forward now. Okay? Now, what happens? When I'm falling forward, if my core isn't strong, my lower body cannot help my upper half. Okay? I'll explain you how. So I'll slightly go back a bit. Let me know if you can't hear me. Okay? So if I'm not falling, if for me to support my upper body with my legs, my core should be strong. Because when I hold a firm stance, the core should engage and help me hold the upper body from falling forward. Okay? So for that to happen, your core muscles should contribute and also should be strong to be able to balance that gap in between. Okay? If the core is strong, the lower body can support the upper body. Okay? We'll talk about making the lower body stronger later, but starting with the core now. So a simple exercise would be called as the pelvic floor activation. Okay? Which is done very simply, just lying down on the floor. I will show you after this. Okay? So it's a very simple exercise. You can do it on your bed. You can do it anywhere, maybe on the yoga mat if you have one. Okay? Very simple. So for that, I'll just put the camera a bit down. Okay? Just a second. So that you can see me. Just give me a second, okay? Just adjusting that angle. Okay. Yeah. So I guess I'm visible now.
Yes.
Right?
डॉक्टर से लेनी है क्या अपॉइंटमेंट?
So the pelvic floor activation. Let me know if I'm not clearly audible. Okay. Okay. So what first task is to lie down on your back. Okay. So I'm on my back now with my legs folded. Now, if you notice, in my lower back region, you see there's a gap here, right? So there is some gap over here. Now, the task is to, as I exhale out, okay, keep your head rested. So as I exhale out, to pull my belly button in and press my lower back to the floor, okay? So as I exhale, I pull my belly button in and I press my lower back to the floor. Okay. And I do this and I hold it for maybe 1, 2, 3 seconds. Then exhale out and release that lower back. Okay. So in the beginning, if you are not able to do it properly, I would suggest you to keep your hands in your lower back region. Okay. Keep your hands in the lower back region just to understand the movement. Just keep it there. So now when you exhale, what happens is, and pull your belly button in, you can feel the pressure of your lower back pressing your hand. Okay. You can feel that pressure as you exhale out and pull the belly button in. You'll feel that pressure on your hand. Okay. And then as you inhale, you release and you feel that pressure getting less. Okay. So simple exercise, just exhale, press your lower back to the ground by pulling the belly button in and release. At a time, do 10 counts, 10 counts of it, really slowly, take your time, and maybe with time you can increase the counts. So are we clear with this exercise or any doubts?
Yeah,
Are
it's
we
clear.
Clear?
It's clear. Yeah, it's clear.
Okay.
Instructions are understood, but we have to try to do that.
Yes, perfect, yes. You should
I'm
all
Santhanam.
try this to get the benefits. Okay.
But
All-
you are, hello,
Yes.
can I speak?
Yes, sure.
Actually, your second exercise, lying
Yes.
on the floor back with the back on the floor.
Yes, sir.
I am not able to lie down.
Okay.
Lying down becoming a challenge.
Okay.
Earlier I was doing full namaskar and all that. Now I'm not doing it.
Okay.
How to?
Okay.
Then how will you do this type of exercise?
In that case, sir, what we can do is in the program we have different variations of exercises for these conditions. We will definitely train you with different movements. Not a problem, sir. Okay.
So
This is
I just want to
today.
interrupt over here. Santhanam sir, we have chair yoga sessions. You cannot, those people who cannot sit on the floor or have problem getting up fast and all, our chair yoga sessions are also very good. And these exercises along with chair yoga, I think it would really help.
Yes. Okay. Shall we move forward?
Yeah.
Yes.
Oh. Yes, I'll just place it up. Okay. Now moving on. So now we understood the importance of core muscles. Okay, so just an example of one activity. There are plenty more, but then today we are to wrap up with the time. Okay, so I'm going to the next half of the movement, which would be the lower body. Okay, so reaching with the lower body, another small exercise which I would to touch upon is the chair squats. Okay, so which you might have already seen, might have tried also before. Okay, but I'll give you some more depth and understanding into why this is important and how we should do it and the variations required for this. Okay, so starting with a simple setup here. So first, let us see the chair squat, and there are situations and conditions where people might find it difficult to even do the chair squats. We will address that later. Okay, but first we look at the chair squat situation here. So why this movement is really important. Okay, so starting with that a little bit. If you see now, you might have experienced this in your daily activities, that you might have sat in your sofa or somewhere in a chair which was really low. Okay, then found it really hard to come back up. Okay, you might have experienced that you're sitting on a chair or a sofa, but you need extra support now to get up from the sofa, right?
Yes.
You might have seen that happening. So why is that happening? It is happening because, see, there is a movement called the hip hinge. Okay, hip hinge means this part of the movement of your hip is called as a hip hinge. Okay, so if this movement doesn't happen effectively, what happens? You will find it difficult to do such activities like getting up from the sofa or anything similar to that. Okay. So by doing activities like the chair squat, it can really help you improve this movement. Okay. But there's step-by-step process to that, but just giving you a little bit of an idea into how these exercises help you in your daily life situations. Okay. Then coming about to your hip flexors. Okay. Topic which I addressed in the beginning of the video, talking about the climbing stairs. Okay. So when you're climbing stairs, what happens now? You raise your leg to climb the stair, right? So now what if this hip flexor is weak? If your hip flexor is weak, you will find it really hard to lift your leg up. So the more harder it gets, the more effort on your heart. Okay. And you will find it difficult to climb more steps. That is why you feel that you're panting and you're feeling a loss of breath after trying to take the steps. So if we strengthen these muscles by simple exercises like this, you will strengthen the hip flexors and you will find it very easy, means maybe better and better with time, to climb the steps also. Okay. So for those cases also, this will be beneficial. Okay. Then coming to another area where you might have seen that you're trying to go for a walk and you fell because your leg didn't come forward at the right time. Okay. Because sometimes you are about to take a step now, but before you took a step, you fell. Okay. And your leg didn't come front in time. So this also can happen because of a weak hip flexor. Okay. Where we teach you simple exercises like a leg swing to help you improve that. Okay. And also these exercises contribute to that. Now moving on towards the movement, let me show you a chair squat. Okay. Even though you might have already tried it, a simple demonstration by me. Okay. Now in the beginning, so as first task is to sit on a very sturdy chair. Make sure this chair is very sturdy, not a plastic chair. Okay. Sit on that. In the initial stage, in case you find it very difficult to stand up, use some hand support, that is totally fine. Okay. But what you need to keep in mind is the posture of your spine. Okay. You see me, I am having a neutral spine, means an upright posture. Okay. So I'm sitting upright on the chair so that I activate my muscles in the right way. Okay. So that is something you need to look at. Okay. Then gently hold the chair if you need support. Okay. Then as you initiate, slightly push the chair and stand up. Okay. So do that as one count. Then as you sit, you have to sit slowly in case, okay, you need additional support, hold the chair and then sit. Okay. A slow movement with control. So you held the chair, you came up, you slowly went down and sat down. Never do a fast movement. Okay. Don't do this. Don't do that. Because there are chances that you might hurt your lower back. So in these conditions, do it very slowly, take your time, no hurry. With time, what happens is you will need less support and you can just stand up. In some certain times, you can also take your knee support like this, okay? To just stand up, that also works. Not a problem. Okay. Now, in situations where one of the person when I had my previous talk had asked me, what if I am not so okay with more counts of sitting and getting up from the chair? Okay. I want an alternative for that. In those cases, I can teach you a very basic thing which can really help you. That is called as the wall sit. Okay. A wall sit. I will show you a demonstration shortly, but first I'll just yes. Okay. So wall sit is very simple. In this, what you're doing is we are going towards the wall. Okay. So assume this is a wall right now. I go towards the wall and I lean back on the wall. Okay. But I'll make sure you have some support around you, maybe a person or a walking stick if you have, or anything around to do support you in the beginning. Don't try it alone. Okay. The first time, just lean towards the wall. Okay. So after you lean towards the wall, you have to slightly step forward. Okay, slightly step forward from the wall as you lean back. Okay, a little bit. I will show you the wall shortly now. I will just rotate this. Okay. Okay. I hope I'll be visible to all. Let me know if I am not. Okay. So am I visible?
Yeah.
Yeah, right. So I went towards the wall now. Okay. I'm standing against the wall. You're leaning back against the wall and you slightly step forward. Okay. You saw my legs going forward, right? As I'm taking the wall support. Okay. Then slowly, slightly you sit down. Slightly. There's a slight curve you can maintain. You can see here that I have slightly slided down. Okay. But not much. Now, the task is to maintain this position for a few seconds, like 10 seconds in the beginning, okay? To start with 10 seconds, then slowly, gradually, as you improve, you can challenge yourself to do more seconds, okay? A simple exercise, but start with proper support and people around you so that you feel confident and safe. Then gradually, once you feel confident, do it yourself with sufficient things to hold on to and by yourself. Okay.
Can you do it in a little more near the cross? Is there no there? Because
Okay.
you are too
Okay.
far away.
Okay. Okay. I'll do that. I'll do that. Okay. I'll do it there. Just give me a second.
Still further front.
Okay. Okay. So,
Yeah.
visible here?
Yeah.
Okay. So now I'm here on top of this. You can see my legs also. Okay.
Yeah.
So first I'm leaning back on the wall. Once I lean back and my hands are on the wall, now I step forward slightly. Okay.
Yeah.
Once I step forward, what I do? I slightly slide down a bit, a slight movement. Okay. You can see my knees are slightly bent. Can you see in the video? Yes. Now you hold this posture for 10 seconds in the beginning and gradually challenge yourself to stay here for 15 seconds as you progress. Okay? As simple movements, nothing much to do. And once you feel tired, press the wall, come back up, stand up, and gently move forward. Okay? But clearly in the beginning, it's preferable that we start with only few seconds because it really puts effort on the endurance of your muscle. Okay? Endurance of your muscle will be really challenged. So only do 10 to 10 seconds and gradually proceed as you feel better. Okay?
Okay. Okay.
That's something to do in case if you are not able to do a chair squat. Okay?
Yeah.
Yes.
Chair looks more comfortable.
Yes. So whichever choice you can do, but both will definitely benefit you. So there are many variations of things in our program which will really help you to, improve and get better. Okay. Then moving down to one of the very small muscle, yet a very effective muscle in the body, that is our calf muscles. So I guess you heard about the calf muscle, which is the lower body. Okay, it is here. The calf muscle, this is the calf muscle, and it is also being told that the calf muscle is the second heart of the body. Why? Because it helps us to pump the blood from the lower extremities to the upper extremities. Okay, that is why it is mentioned as the second heart, and we have seen that the research is today speaking about something called as the soleus push-ups. Okay, so soleus is a muscle beneath the bigger muscle of the calf. So the bigger muscle is called as the gastrocnemius. Okay, beneath that is the soleus. Okay, so they have found out that the soleus push-up, which I'll show you now, which is very simple. You have never done that. Seated calf raises. Okay, I will just show you now. So seated calf raises have been seen to really help in regulating blood sugars. If you are doing it for 3 hours in a day, not in one go, but spread out in the day, okay, it has shown significant benefits in regulating the blood sugars. Okay, and also helping to strengthen the lower extremities muscles there, okay, and helping you with the balance aspect also, okay. Going forward with the movement, it is very simple to do. You might have already tried many situations, okay. So I'm sitting here. So what I'm doing is I'm just raising the heel, okay. So it's called as the soleus push-ups because it's activating the soleus muscle and doing it for a good amount of time throughout the day. Whenever you are watching TV or you're sitting and doing some leisure activities, please do this. It really helps to regulate the blood sugars and also strengthen those muscles in the legs, okay. So that way you can also help and reduce the risk of falls, okay. Yes, so that would be something to take from today. Few exercises what we learned is something for the grip strength, using a small smiley ball to begin with, then the wall push-ups which we did, okay, to help you improve the upper body strength. Then we went on to the core muscles, which was the pelvic floor activation, simple as that. Then we went to the chair squats, okay, and a modification to do with the wall sit, which we tried, and finishing off with the heel raises, activating the calf muscles, okay. So in the program, we have a guided video done, which has specific exercises, which caters to balance and various other aspects of the human body. So that will help you.
We can't hear you, Roshan. It's very, it's very, volume is very low.
No,
No.
no.
Oh, 1 second.
No sound.
No, it's still not audible. You can, if you want, leave and join again, or we can just conclude the session.
Am I audible now?
Yes.
Yeah. So I changed the speaker. Okay. So I may not be on that screen. I've just changed it here. 1 second. Give me a minute. Yeah. Yes. So that was the conclusion of today. Okay. And the program will have certain guided videos with each aspects to help you strengthen your body and prevent and reduce the falls. Okay. So that's all for today. Thank you all for joining us. It was a great time. Thank you.
Thank you, Roshan, and thank you, Dr. Nischal also. I don't know he's here. And it's been a wonderful session. And I'm sure I've seen that everyone is here from the beginning to now. They have gained a lot from this session. And it is very complete program which you have devised. It is with, all the tests and all, it's based on each individual's requirement, how to plan your life in a way that you are safe and secure from falls. And if anyone has any questions, while from our team, if you have anything you want, you can get in touch with us, and we will, connect you with Bhargav from the team, and you can get all the details. And any questions, if any of you have, you can please ask.
That questionnaire we haven't received it.
I will send it today or tomorrow. We will send the questionnaire.
For sure.
Because it has to be sent to everyone. We will send it. Please stay updated on your WhatsApp. From where you have registered, you've got the link. There only you will get the questionnaire. I hope all of you are registered with us, because registered people will get the questionnaire because their data we have. We don't have everyone's phone number. And anything else?
That's it.
Okay. Thank you so much. Once again, we have already overshot the time.
Thank you, everyone. Dr. Roshan, Dr. Nischal, Sunita ji. Thank you very much. It was a wonderful session. Yes, we have gained a lot.
Yes. And while this is a wonderful session, there are exercises they are doing. We would also like to let you know that Happy 60 Plus is also doing a lot in this. And please stay in touch with us. And apart from this, we keep having a lot of webinars every Thursday. We have a wellness webinar. Once initially we started with nutrition, then second was mental wellness. Now it's going to be on sleep hygiene. So these are all free webinars. Please join them and stay enlightened. And tomorrow is our free chair yoga session. And join it and enjoy the session. It is very good and it will be very helpful. There are certain tips also on diet and all also. You can get.
आप भी कर सकते हो.
Okay. So I think thank you so much, Nischal ji and Roshan. I'm actually not opening my video. I had I had high fever today, but I was able to, all my fever got forgotten when I was listening to the entire thing. So it's
Okay,
wonderful.
okay.
Thank you. And we
Wonderful.
will update you regarding any queries if they are coming from our members.
Sure, definitely.
Yeah. And
Thank
thanks
you.
to Bhargav
Yes.
for organizing this for us. Okay, I think we can leave now.
Yes.
Okay. See you all. Bye.
Thank you so much.
Okay, bye-bye.
Bye.